Hey, friends. So I thought this was really interesting. One of the groups that I follow on Facebook with practitioners, um, it was kind of crazy because I was reading this about basically the practitioner had posted that said that one of her patients had came in for annual labs. And so those annual labs, if you're not familiar, typically, and this is whether it's insurance-based medicine or um, like a DPC, like we are. And so typically that's a CBC, a CMP. So CBC is a complete blood cell count, CMP, comprehensive metabolic panel, TSH is for your thyroid, A1C for diabetes, a urinalysis, checking your kidney function, and then cholesterol, right? A lipid panel. If you're a male over 40, then we also check PSA, which is for the prostate. So those are the basic labs that you would do once annually. And in this post, it said that, and I was not familiar with this. So if you're familiar, chime in. But I was literally floored because it said that insurance companies are now not allowing those labs as physical labs. So basically, what they're saying is that if you have to have a symptom, a reason to have those labs drawn. So my question is this, um, are they wanting you to be sick before you actually get something checked? Because from my understanding and my training, these are all preventative measures. We're trying to prevent something from happening. So why now are they no longer allowing those labs, which are just basic labs, that now you can't get them annually? In fact, someone was posting that they're recommending every 5 years. And another recommendation I saw was to not even check your thyroid until you're over the age of 65, which is insane to me. So I'm just putting it out there because, again, you're going to start to see the difference. I keep trying to, make you all think about this, but that is why DPC, I believe, is superior. Um, because when insurance wants to pull crap like this, where you can't even get basic labs, these are basic labs every year, not every 6 months. We're saying once a year because a lot can change in a year. That now they're not authorizing it. Um, But something like a TSH, they're saying over the age of 65. I would like to say how many people that I have diagnosed with hypothyroidism or hyperthyroidism, asymptomatic, no clue. They literally just came in for their annual lab draw. This is preventative. This is what we do in direct primary care. We're trying to take the best care of you so that you're not getting sick, right? We want to catch things before you become symptomatic, not become symptomatic and then come in and see me. That makes no sense. The other thing that I'm going to say is, as you know, with our transition of converting, DPC and adding functional medicine to it, we also have, which I think is super cool. Anyone that's joining us now is going to get, whether you say with the DPC, which we're saying is DPC essential, and then those that want to upgrade and have more of the functional medicine is DPC plus. But any person, everyone who joins, basically now you're getting what we're saying is a more comprehensive, um, we say functional medicine panel. It's not really functional medicine. It's just looking at things a little bit deeper. So not only are those labs that I was just talking about, but we're also adding on there things like your reverse T3, T4, thyroid antibodies, because a lot of times those are missed. We're adding on fasting insulin. A lot of times before your fasting blood sugar increases or that A1C showing that you have diabetes, a lot of times your fasting insulin is going to be seen as being off. Magnesium is added in there. So there's so many more labs. I believe it's a 27 lab test, point lab test. that we're now including. And so again, I'm just, I'm frustrated going back to that post because we're doing our patients a injustice. I don't believe that we need to wait until people are symptomatic before, whether it's insurance or not. I don't think you should wait that long. Sometimes waiting until you're symptomatic is too late. And so we, and I can only speak for my team, on-site medical care, MedSpa 719 team, we're in the business of checking to prevent. We want to make sure that before you become symptomatic, we're seeing what's going on with you, right? Um, Always here to help. But man, that was pretty crazy. If you've had that experience and you have, insurance-based medicine, um, definitely when I say insurance-based, but you know what I mean, you have insurance and you go to a regular healthcare provider, but you just follow us. Tell us about it because I think it's insane. That's not what we do for our patients. We have to do better. Um, we do better. So I just wanted to share that story because it really did blow my mind. All right. Talk soon.